Hello everyone. How's everybody doing out there? It's Dr. Nicole, your board certified family physician. I'm gonna wait a few minutes to invite some more people to come in. Please share this video. Sharing is caring. I'm gonna wait about a minute, let you go and invite your friends. If you want to learn about overactive bladder and prostate swelling, and how it affects you, I want you to go and invite your friends. Tell them that they need to learn about this. Bring them in, bring them in, bring them in. How's everybody doing? Today is, what is today? Let's see. It is Sunday, July 30th at 3:09 p.m. Eastern Standard Time. Again, I'm Dr. Nicole, your board certified family physician. I want you to go and share this video. Tell everybody to come in. Let's learn something today. How's everybody doing out there? Did you have a great Sunday? Did you go to church this morning? Did you go to your place of worship? Did you sleep in? Did you get some work done? Are you having fun today? Are you relaxing? Are you doing some self-care? Are you taking care of yourself? That's wonderful. I want everybody to do that. Please go and invite your friends. Invite everyone to come on in. I'm just going to wait a few more seconds. We'll start at 3:10. It's been a busy week. Has it been a busy week for you? It's been like a really busy week for me. I was on a conference last week, or the week before last, and so this past week was my first week back, and I tell you, it's been really, really busy. So, okay. So it's 3:10, and we're gonna go ahead and get started. I am Dr. Nicole, your board certified family physician. I specialize in treating and preventing chronic medical conditions and educating everyone on those conditions in everyday, understandable terms. Through my programs, my speaking, my concierge practice, and my books, I help pastors and everyday people live their best lives and improve their mind, body, and spirit so that they can impact the lives of their families and their congregations and their communities. Please follow me on social media, on Facebook, www.facebook.com/Dr. Nicole D.O. That's DrNicoleDO. And to get more information about all of my books and programs. All right, so let's get started. Like I said earlier, I did go on a conference about 2 weeks ago, and the conference was an update on hypertension and the prostate. And so at this conference, we talked about the bladder and overactive bladder, and I know that is an issue for a lot of people. There's that commercial on TV, gotta go right now. And so there's medications out there that you can take to help it so that you don't have to go as frequently. So I wanted to just give some information because not everybody knows what BPH is. BPH stands for benign prostatic hypertrophy. So the prostate is a gland in men. It's inside, the quickest way to get to it is through the rectum, just inside the rectum. The urethra goes through that gland, and so when it gets swollen and when it gets bigger, sometimes, or a lot of times, it will decrease the urine flow. And so it's very important that you're aware of the prostate. One of the biggest things that I learned in this conference is the rate of prostate growing and prostate enlargement is really, really large. So for males in their 50s, at least 50% of them will have BPH. In their 60s, it's 60%. In their 70s, it's 70%. So you can imagine in your 90s, 90% of males will have benign prostatic hypertrophy. So that's actually a good thing, because that means if you have it, that means you're still around, you're still here. So it's not a bad thing to have a little BPH. It is benign, so it's not cancerous. There is a difference. There's cancerous growth of the prostate, and then there's the benign prostatic hypertrophy. So, like I said, most men in their lifetime will deal with the benign prostatic hypertrophy. So, what do we need to learn about BPH? BPH can cause two types of symptoms. There's irritative symptoms and there's obstructive symptoms. So irritative symptoms are urgency. That is when you have to, good afternoon, Superior. Thank you. I appreciate that. Irritative symptoms are urgency. So urgency is that feeling that I got to go right now. So as soon as you have to go to the bathroom, you have to go right then and there. That's that gotta go right now sensation that we're talking about. Then there's frequency. Frequency is when you have to go so often. So it feels like you just went to the bathroom an hour ago and now you got to go again. That's called frequency. So when you have BPH, it can cause frequency. There's also something called nocturia. Nocturia, I'm in love with you too, Mr. Edwards. Nocturia is where you go to the bathroom a lot at night. And so that's not necessarily always a bad thing, other than it can be disruptive, not only to you, but to your spouse or your mate, because you're getting up, absolutely, you're getting up over and over again to use the bathroom. So those are irritative symptoms. They're irritative to the person who is experiencing them. Then you've got what's called obstructive symptoms. So when the prostate gets too enlarged, it can obstruct the flow of urine through the urethra. Those obstructive symptoms are things like weak stream. So men, when you notice that your stream is not as strong, the urine's not coming out as strong as it used to come out, that's an obstructive symptom. There's hesitancy, so where you have to kind of stand there, and what I tell my patients, you kind of got to give it a pep talk to get it started. That's called hesitancy. And then there's incomplete emptying, where it feels like you're done using the bathroom, but your bladder is not all the way empty. There's still some left over. So that is obstructive symptoms. That means that the prostate is obstructing the flow of urine to come out. Now, I know I'm talking a lot about the prostate, but ladies, we can deal with overactive bladder as well. And it's just as annoying in ladies. Ladies, we can have urgency and frequency as well. Now, ours is not, of course, coming from the prostate, because ladies, you don't have a prostate. I did have a patient one time that came in and asked me if I could check her prostate, and no, honey, we can't check. Ladies don't have a prostate. So ladies, your urgency and frequency is often coming from something else, whether that be bladder floor weakening, or pelvic floor weakening, or some kind of irritant to the bladder, or sometimes an infection in the bladder. That's what causes ladies' frequency. And the term OAB, or overactive bladder, ladies and gentlemen can have that, but a lot of times we hear that in ladies. So the bladder, like I said, the bladder sits on top, and then the urethra flows from the bladder in ladies and gentlemen. And so you can have where your bladder contracts too much, and so that's where we have the overactive bladder. So things that you can do, gentlemen and ladies, about those bladder symptoms, there are some ways that you can improve your diet and your lifestyle to help with that overactive bladder and the BPH symptoms. The main two bladder irritants are caffeine and alcohol. So if you are used to having your cup of coffee every morning and a couple during the day, and then your sodas, and then your sweet tea, and all of your other caffeinated beverages, then you are more likely irritating your bladder. And so then you're going to be going a whole lot more. Hey Raven, how are you? I haven't heard from you in a while. Good to see you. So these bladder irritants, if you limit the amount of caffeine you're taking in, and of course your amount of alcohol you're taking in, then you cannot have as much irritation to the bladder, and then you won't have to go as often. All right, so we also found out during this conference, I learned that ladies' bladders hold just a little bit more than men's bladders. So we can hold our urine just a little bit more. And so men's symptoms can tend to be a little bit more irritating to them because they have smaller bladders, okay? Let's see, what else did we learn? There are other irritants to the bladder as well, so things that we eat, things that are like spicy foods, jerk, cumin, and curry can also irritate the bladder. So if you like to have the Caribbean food, and my conference went on in the Caribbean, it was great. So there was a lot of getting up to use the bathroom because we were eating all of these irritants. But if you like to eat those spicy foods, then that can irritate your bladder also, and you'll be using the bathroom more often as well. All right, so if you take a decongestant for your nose, like if you got a stuffy nose and you use a decongestant, then that can also cause your bladder to contract more. And so decongestants will also make you use the bathroom more, okay? So what can we do about the overactive bladder and also about the benign prostatic hypertrophy? Well, first of all, like I said, limiting your caffeine and limiting your alcohol intake will definitely make a big difference in your overactive bladder. Also, getting rid of the irritants such as the spicy foods or limiting the spicy foods can also help. So there are medications also that we can prescribe, that doctors can prescribe, that can help. Oh, before I get to the medications, so fellas, if you want to help to decrease the size of your prostate, hey there, Cleva, how are you? Good to see you. Thanks for joining in. If you want to shrink the size of your prostate, gentlemen, there is a supplement out there called saw palmetto root. That's S-A-W. Next word is palmetto, P-A-L-M-E-T-T-O, root. Typically about 320 milligrams or 2 tablets are what you can take daily, and that can help to shrink the size of the prostate. You shrink your prostate, you don't have as many obstructive and irritative symptoms, okay? So taking your saw palmetto root, fellas, definitely helps. So what medications can help? There are, well, having some malfunctions here with the camera, but that's okay. There we go. So there are tamsulosin or what's the Flomax is the medication that gentlemen can take to help to shrink the size of the prostate. And it's a prescription that you take. It can also help some with blood pressure, but we mainly prescribe it for the benign prostatic hypertrophy in gentlemen. Actually, what they said in the conference was it's the majority of internal medicine and family medicine that prescribe the Flomax. It's not so much coming from the urologist. So that is something that you don't need to go see a specialist for. You can go to your family doctor and they can take care of these symptoms, okay? Also, there are medications that we can give for ladies for overactive bladder. The ones that you see on TV, Detrol. I don't have to go right now. That helps with the overactive bladder symptoms as well. There's also another one, oxybutynin, that we can give. Oxybutynin, though, often causes some dry mouth, dry eyes, dry skin, but it will help with the overactive bladder symptoms, okay? So, just to recap, if you are going to the bathroom a lot, gentlemen, that can be coming from benign prostatic hypertrophy or swelling of the prostate. That does increase with age, so if you have it, it's a common thing, okay? And there are ways that we can treat it. So you can have irritative symptoms such as urgency, frequency, and going to the bathroom a lot at night. That's called nocturia. And then noct, N-O-C-T, meaning like nighttime, and then urea, meaning urine, so urinating at night. And then you can have obstructive symptoms of weak stream, hesitancy, incomplete emptying, decreased force of the stream. Those are the obstructive symptoms, okay? So, excuse me, gentlemen, you can take the saw palmetto root every day, and that can help to shrink down the prostate. And ladies and gentlemen, you can limit your caffeine and your alcohol intake. That will definitely help with the muscarinic receptors. That's what they're called in the bladder. That causes them to contract, and that makes you feel like you have to really go. So by no caffeine and no alcohol, your bladder should be able to hold more fluids, and then you won't have to go as often, okay? Then there are also food irritants, such as spicy foods like jerk, cumin, curry. Those all irritate the bladder. And decongestants also can irritate the bladder and make you really, really, really have to go, okay? Medications that we can give, tamsulosin to help shrink the prostate in gentlemen. Honestly, Cialis, which I'm sure most people are aware of, Cialis use for erectile dysfunction. That's a as-needed use, but if you take a smaller dose of Cialis daily, that can also help to shrink down the prostate. Okay, so sometimes you might see, ask your doctor about getting on a daily small dose of Cialis to help shrink down the prostate if you're having those symptoms. You need to get your prostate checked at least once a year, gentlemen. If you have a family history of prostate cancer, then you also want to be screened for prostate cancer by having a blood test called a PSA drawn at least once a year. Starting in your 50s if you don't have a family history. If you do have a family history, though, you need to start probably about 10 years before that family member was diagnosed, so anywhere between 40 and 50, okay? So that's called a PSA. It's a prostatic specific antigen. It's a blood test. We can check that to see if your PSA is elevated. Hi there, Miss Joyce. How are you? Miss you. We can check that PSA level. So fellas, you want to get your prostate checked at least once a year, and you want to get that PSA drawn if you're between the age of 50 and 70 or earlier if you have a family history of prostate cancer. All right. The decongestants, again, can also cause overactive bladder symptoms and the irritative bladder symptoms. So if you're taking a decongestant for, a stuffy nose or runny nose, you will notice that you're going to the bathroom more frequently, okay? So, did you guys learn a lot? I hope you did. Again, I'm Dr. Nicole, your board-certified family physician. I specialize in treating and preventing chronic medical conditions and educating people about those conditions in very understandable terms. Through my programs, my books, my speaking, and my concierge medical practice, I help pastors and everyday people to live their best lives and transform their mind, body, and spirit so that they can have a bigger impact on their families, their congregations, and their communities. Again, follow me on Facebook. Please share this video if you like it. Let others learn about the prostate and the overactive bladder, and join me on Facebook. That's www.facebook.com/Dr. Nicole D.O. That's DRNICOLE.DO. And there you can join my community and you can learn more about other health issues and health topics. I will come back later on this week, probably midweek, so that I can also give you an update on the other thing that we learned at the conference, which was hypertension. So let me explain some things about hypertension. Let's do Wednesday at 7 p.m. Eastern Standard Time, okay? So Wednesday at 7, please get your friends if you want to learn about what is hypertension and how it affects you and what you can do to treat your hypertension and to live better with your hypertension, all right? And how to prevent getting hypertension, okay? So thanks again for joining me. Let me just explain who I am one more time for those who didn't hear it. I'm Dr. Nicole, your board-certified family physician, and I specialize in managing and treating chronic disease and educating people about those diseases in understandable terms. Through my books, my programs, my speaking, and my concierge medical practice, I help pastors and everyday people transform their lives and impact their mind, body, and spirit so that they can have a better impact on their communities, their families, and their congregations. All right, please join me on Facebook Live Wednesday at 7 p.m. to learn about hypertension, and follow me on Facebook, www.facebook.com/Dr. Nicole D.O. Have a great day. Looking forward to seeing you later. Bye-bye.